In this video lecture, I am going to talk about the use of glucocorticoids for a variety of skin diseases, the mode of administration of these drugs, how to select a steroid for a given skin disease, the mechanism of action, therapeutic uses, adverse effects, and some of the application and usage guidelines for steroids. So glucocorticoids are widely used for the management of various skin diseases because of their anti-inflammatory and immunosuppressive properties. In terms of mode of administration of these drugs, they can be applied locally through topical or intralesional routes. Intralesional route implies injecting the medication directly into the specified skin lesion or the affected area, and this involves delivering a high concentration of the drug to the affected area to produce a therapeutic effect. The steroids can also be administered systemically through oral, intramuscular and intravenous routes. Now coming to topical steroids, there are a wide range of topical steroids that are available in the market. So how to select a topical steroid for a given skin disease? The topical steroids are selected on the basis of potency, one. Secondly is the site of involvement, and third is the severity of the skin disease. So the topical steroids are grouped into 7 classes from class 1 to class 7 in the decreasing order of potency. So class 7 steroid is a mild steroid and class 1 steroid is very potent steroid. An example of class 7 steroid is hydrocortisone. Hydrocortisone is the preferred steroid for application on face where the skin is thin and in occluded regions such as the armpit and groin. Next is class 6 steroid. An example of class 6 steroid is clobetasone butyrate, and this is used in mild to moderate dermatosis or mild to moderate skin disease. Next is class 3 to 5, and this group includes steroids such as betamethasone and fluocinolone. These are potent steroids and they are preferred in severe skin disease. So the next is class 1 and class 2, and in this group is included clobetasol, which is a very potent steroid, and this should be avoided for use on face and neck in occluded areas such as armpits, and they are preferred for treatment of very severe skin conditions or in case of failed therapy with other steroids. In this way, topical steroids should be selected on the basis of potency, severity of the skin disease and the site of involvement. So more severe the skin disease, more the potency of the steroid to be used, and if the skin condition is less severe, so less potent steroid is used. Also the site of involvement is very important, because if the site of involvement is the face where the skin is thin, so a least potent or a mild steroid such as hydrocortisone is preferred, and in thick skin areas such as palms and soles, a more potent steroid can be used. It is to be noted that inappropriate use of topical steroids on the face can cause perioral dermatitis, a kind of rash which appears around the mouth. Also, it is to be kept in mind that class 1 steroids are highly potent steroids, and chronic use of class 1 steroids can cause thinning of the skin, atrophy, stria formation, telangiectasia, eruptions. So these are some of the side effects of chronic use of highly potent steroids. So the practitioner should be familiar with at least one steroid belonging to each class in order to facilitate appropriate selection of the steroid for a given skin disease, and also to minimize the risk of side effects that are associated with the use of topical steroids. So now let's move on to the mechanism of action and effects of topical steroids. The topical steroid, when applied to the skin, penetrates through the skin and binds to the glucocorticoid receptor that is present in the cytoplasm. The glucocorticoid and the receptor complex then moves to the nucleus and modulates the transcription of genes. This results in changes in the genes. The changes in the genes can result in reduction in production of inflammatory cytokines and inhibition of arachidonic acid cascade, resulting in its anti-inflammatory effect. So they are used in a variety of inflammatory skin conditions. Topical steroids also have immunosuppressive action because of apoptosis of the lymphocytes, as they decrease the function and the number of immune cells, resulting in its immunosuppressive property. Thirdly, the topical steroids also have anti-proliferative action. They inhibit the DNA synthesis and cell division, and therefore they are used in hyperproliferative skin diseases such as psoriasis and seborrheic dermatitis. Also, they have vasoconstrictive properties, so they reduce the blood flow to the skin, decreasing the redness and erythema, which is associated with inflammation. Therefore, topical steroids are widely used in a variety of skin disorders because of their anti-inflammatory property, immunosuppressive action, anti-proliferative action, and vasoconstrictive property. Next, we come to the therapeutic uses and adverse effects of glucocorticoids that are useful in various inflammatory and hyperproliferative skin diseases. So, as I mentioned earlier, glucocorticoids can be applied topically or through intralesional routes, or can be administered systemically, that is oral, intramuscular or intravenous routes. Some of the common indications of topical steroids are atopic dermatitis, contact dermatitis, seborrheic dermatitis, psoriasis, which is associated with scaly lesions, lichen planus. So these are some of the common indications where topical steroids are used. Intralesional administration involves injecting the medication directly into the specified site, into the affected area, and this delivers a high concentration of the drug to the localized site. This enhances the therapeutic effect and minimizes the side effects. So this type of administration is preferred for localized treatment to minimize the side effects and provide targeted therapy. Triamcinolone preparations are available that can be used, that can be delivered through intralesional routes. Next is the use of systemic steroids that are administered orally, and they are usually preferred, or it is the preferred mode of administration for severe life-threatening skin conditions, for vesicular bullous skin diseases such as pemphigus vulgaris or bullous pemphigoid. So these are severe skin conditions where oral corticosteroids can be used. Pulse therapy involves injecting large IV doses of methylprednisolone in severe resistant pyoderma gangrenosum, dermatomyositis, SLE with multisystem diseases, bullous pemphigoid. So these are some of the life-threatening disease conditions where large IV doses of methylprednisolone can be used. However, rapid infusion should be avoided as it can lead to hypotension, electrolyte shift and cardiac arrhythmias. It is to be kept in mind that long-term use of oral glucocorticoids are associated with side effects, and this is related to dosage and duration of treatment. So more the dosage, more is the duration of treatment, more is the likelihood for side effects. The side effects that are associated with chronic use of glucocorticoids are weight gain, hypertension, precipitation of diabetes, precipitation of glaucoma, myopathy, osteoporosis, psychiatric disorders, suppression of adrenocortical axis. So these are some of the side effects that are associated with chronic use of oral glucocorticoids, and therefore glucocorticoids should be used with caution. The oral prednisolone should be preferably administered in the morning. However, it can be given in divided doses to enhance efficacy. Alternate day therapy can be used to reduce the incidence of side effects. Also, short-term administration of oral glucocorticoids is preferred, and if necessary, the long-term use should be monitored closely for side effects. With respect to the use of topical steroids, a thin layer of the medication should be applied on the skin so as to reduce the penetration. Secondly, avoid using highly potent steroids on the face where the skin is thin or in occluded areas such as the armpits and groin regions. The selection of the steroid should be appropriate based on the severity of the skin condition and the potency of the steroid. So in this lecture, we have discussed the steroids that are widely available in the market, the appropriate selection of the steroid for the given skin condition, the therapeutic uses, adverse effects, application guidelines, precautions associated with steroid use. So thank you for watching. If you find my video useful, please like and subscribe to this channel.